Mr. Singh, Happy New Year.
Yeah,
I have
yeah,
some COVID questions for you. I asked
sure.
you last week about the Canadian government potentially bringing in testing requirements for people coming from China. Your answer was that we should listen to the experts and take their approach. We've heard from the experts now that the government's brought this in, saying that it's basically useless and we shouldn't do it. So now that they brought it in, what do you think? Was this the right thing to do?
This is one of the things that we've been finding in general with the approach of this government is they've not been doing the best job of being transparent with what the evidence is and what the recommendations are from the experts and the decisions being taken. And the reason why that is so important is that when we don't have transparency and we don't have the public health experts providing us with the reasons or providing the government providing that rationale of the experts, providing that reasoning, then people start to lose trust. And so I would encourage the Prime Minister and the government to ensure that every decision we're making is backed up by the evidence and the advice of experts. And when it's not, we need to be very clear that then it's not the best evidence we're receiving, or it's not the guidance from public health experts that we're receiving. And this is an ongoing critique I have of the government that when we don't have that evidence-based decision making or the experts reasoning that's being presented by the government, then the government starts to erode the public trust in the decisions being made, and that's a problem.
In the US, in a number of American cities, Philly, Boston, some places in New Jersey, and school districts there, they're bringing back masking. That's not something we're seeing in Canada. That doesn't seem like there's many school districts interested in doing that. Do you think that's something we should be doing in schools at this point in time?
Again, with any healthcare protocol, in this case, the mask protocol or putting in place more masking, this is something that we, well, again, would defer to the expert advice. My understanding of the advice is that masking does help. It does help reduce the spread of infection, and we're seeing a time period of serious respiratory illness increase and the rate of infection increasing and the rate of people getting sick increasing, and masking has been effective in the past. So the evidence seems to be there, but again, I would defer to the public health advice, and then we should be following that advice and doing the best we can to keep people safe and healthy.